Good morning, everybody, and welcome to our webinar this morning. We're joined by Kat Glue and Louisa Steele, and they're going to be talking us through some guidance for homeless services on domestic violence and sexual abuse during COVID-19. Before we get into the presentations, I would just quickly like to do an overview. You should be able to see my screen. I want to do a quick little overview from Fianza's side. Just to mention that this is part of our Breakfast Bite series that we're running on a whole lot of issues related to COVID-19. Today's topic, of course, is around domestic abuse and sexual violence. I'll hand over to our speakers in a moment, but I just want to reiterate that this is part of a wider series that we've been running every Wednesday morning. The webinars are recorded and uploaded to our website, so you can find them. I'll send a link after this presentation, but you will be able to find all of the recordings on our archives over on our website. So we've done webinars on self-care for frontline workers, motivational interviewing, how do you define things like youth homelessness, and then more recently we are, I guess, diving into the consequences of COVID-19 as a lot of it becomes a little bit more real for homeless services. So we looked at trauma-informed tips and how do you deliver trauma-informed service during COVID-19 for both staff and clients. And last week we looked at some problem-solving techniques during COVID-19. And of course, today's topic is more focused on domestic violence and sexual abuse. Just very quickly, I want to mention, many of you are probably aware of Fianza as an organization. We recently changed our membership structure. So previously, to become a member of Fianza, you had to be a national organization. That has now changed. You can be a national organization. You can also be operating at a local or regional level. We accept foundations and think tanks into our membership, and we accept local, regional, and national policymakers, so cities, ministries, agencies. It's part of our wider coalition building to end homelessness in Europe. And of course, there are many benefits to joining our membership: policy development, contributing to our clusters, leading our work, international practices. When COVID-19 is over, we'll return to site visits and different transnational exchange programs. So that's just a little bit about Fianza and the webinar series. I'm going to hand over to Kat and Louisa now, who are going to do their presentation. Quick reminder for all participants, particularly if this is your first time using GoToWebinar, there's a questions box on the right-hand side of your screen. There you can put in questions throughout this presentation, and at the end, I'll be feeding those questions back to our two presenters. So if you have any questions or comments you want to make, please feel free to share those. So one moment, I'm just going to share our screen now with Kat. Okay.
Thanks, Robbie. Okay. Let's see if I can share my screen.
Perfect.
All right, I'm hoping you can see my presentation now. There we go. All right, perfect. So my name's Kat. For the introduction, Robbie. I work for St Mungo's, which is based in London, and it's a homelessness charity that operates across London and the south of England. And I am the Women's Strategy Manager for St Mungo's. So my role involves understanding how our female clients experience homelessness differently, and how St Mungo's as an organisation can best work towards ending women's homelessness. So today, myself and my colleague Louisa Steele from Standing Together will be talking a bit about women's safety during COVID-19, particularly focusing on domestic and sexual violence, which is the focus of our partnership, which I'll talk about now. So both St Mungo's and Standing Together are part of the Safety by Experience project, which is funded by Homeless Link, Ending Women's Homelessness Fund. And the partnership's led by Standing Together with St Mungo's as the operational partner. And the purpose of the partnership before the pandemic was to work with women who'd experienced homelessness and homelessness staff and managers to produce new guidance that's specifically tailored to homelessness settings. Because quite often we were seeing that the traditional tools and approaches used in the women's sector don't quite work as well with women facing homelessness and multiple disadvantage, and staff are finding that They were struggling to accurately assess risk and provide safety plans with women who are experiencing homelessness. So our partnership was planning to produce some new tools. As you can imagine, plans have changed slightly due to COVID-19, as I'm sure everybody's plans have. So we've decided to spend the next 3 months developing guidance, providing advice, and running information sessions like this one to help staff understand the issues affecting women during COVID-19, particularly domestic abuse and sexual violence, and to provide some ideas and guidance about how staff can best support women during this time and keep them safe. So Louisa will be talking in more detail about our domestic abuse and sexual violence guidance, which is linked on this slide. It's also available on the Standing Together website. If you search Standing Together Against Domestic Violence, they've got a page of coronavirus guidance, and our guidance is available there. It was also produced in partnership with SHP, Fulfilling Lives in Islington and Camden project, so I should credit them as well. And we've also drawn on the work of the Women's Homelessness Action Forum, which is a London-based group of homelessness providers working with women, as well as women's sector, mental health, other providers working with women facing multiple disadvantage. So their views are also reflected in what we're talking about today. So a bit about what we'll cover today on the agenda. Because this fianza covers Europe, I wanted to give a bit of background on how the response has been in England to COVID-19, as I'm aware it might be quite different in different countries. So I'll just give you a little bit of an idea about how authorities and agencies have been responding in London and the rest of England. And then we'll share a bit of emerging evidence and practice from homelessness services that we've been in touch with. I think it's important to say that both of us are London-based, so there may be a bit of a London slant to what we're talking about today, but we've both also been involved in conversations with women's sector and homelessness providers more broadly across England, so we'll try and reflect their experiences as well as best we can. If anybody on the call is from areas outside London in England and wants to share their experience or ask questions, please do note those questions down, and we're happy to reflect on those at the end. All of this is still emerging and still early stage, so we've by no means got all the answers or all the evidence yet. And then we'll just have some time for questions. So to give you an idea of how we've been responding to COVID-19 in England, so there's been quite a major drive by government to make sure that people sleeping rough in England are accommodated during COVID-19 and are able to self-isolate. And one of the ways that's been achieved is by establishing new services in vacant hotel rooms. So the earliest hotels were set up by the Greater London Authority in London. Those are managed by providers like St Mungo's. And it means that people who've been sleeping rough or who are at risk of rough sleeping have somewhere to go during the pandemic period. Unfortunately, not everybody has access to those. There are still people coming to the streets who are newly homeless, who are not inside yet. But the estimate is around 90% of people who are known to be sleeping rough have been offered hotel accommodation. So what we have now is a large number of people who are either new to the streets or have been sleeping rough for a very, very long time, who previously may not have felt able to accept support, staying in hotel accommodation, which is a fantastic opportunity really to address rough sleeping in England in a way that hasn't been done for a long, long time. But it does also pose challenges, as those services are large. They can be up to sort of 100, 150 beds. And staff are obviously working with clients they perhaps don't know so well. So they may not have those established trusting relationships with clients that you might have in a smaller service. So in London specifically, hotels have been split into 3 categories, and I think this in other areas of the country, people may be able to correct me on this. This is happening to some extent as well, though I think practice does differ. The 3 categories, they're asymptomatic low risk, so for individuals who don't have symptoms of COVID-19 and don't have any underlying health conditions that would put them at particular vulnerability. And then there's COVID care and COVID protect. COVID care is for high risk people, so people perhaps with respiratory issues, underlying health conditions that would put them at high risk of contracting the virus. And COVID Protect is for people who have symptoms of the virus. I think that's the right way around. Someone might correct me on that. So those hotels have some clinical input from specialist homeless health teams, but I think in different areas of the country they are functioning quite differently. The approach that's been suggested by Pathway, a faculty of homeless health, which is so the Pathway is a homelessness health charity in England, is to follow a triage, assess, cohort care approach. That I think is being followed to different extents in different areas, but there's a link on the slides there and you can find out more if you're interested in comparing how that's being approached in your area versus in London and broadly in England. So I wanted to talk a bit more about some of the issues affecting women facing homelessness and COVID-19 together. So I think the overall point that we're trying to stress through our work is that COVID-19 is not the only risk facing women at the moment. I think what we're seeing is that existing risks that women facing homelessness are experiencing are changing or being amplified by this pandemic period. And that obviously is very challenging for those individuals, but also for services to respond to at a time where staff are stretched, many people are having to take absence due to sickness or self-isolation, and people are really struggling and trying their absolute best to adapt to these new times and new ways of working. So increase in domestic abuse, sexual violence and exploitation. The increase in domestic abuse is well documented worldwide during COVID-19. In England, we've seen a spike in calls to our National Domestic Abuse Helpline, but in tandem with that, a reduction in the availability of refuge spaces as refuge services are starting to fill up and having to put in additional safety measures in place to deal with the pandemic. There are certainly risks for women who are involved in selling sex. Sometimes those may be more hidden now. Women may be starting to sell sex for the first time due to cope with destitution or poverty during the pandemic. But I think all these, in all forms, that kind of sex work is more high risk at this point, because either it's done behind closed doors where there's more opportunities for exploitation or violence, or it may be with high risk clients, the kind of people who are still interested in buying sex during the pandemic period may well be exhibiting more risky behaviours and pose more of a risk to women. Challenges around sexual and reproductive health, access to contraception, abortion care is an issue, and also the effects that coercive control can have on someone's reproductive autonomy. Certainly, we're fearful that women will come under pressure and be subject to sexual violence during this period and may experience unwanted pregnancy as a part of a coercive and controlling relationship they're experiencing. Women who are pregnant, obviously this is a hugely stressful time, and women who have children, perhaps who aren't in their care, and the women that we're focusing on with this project are single homeless, so-called single homeless women who may be mothers, but their children will likely be in care, so may have been adopted or be cared for by other family members or in foster care. And this pandemic may disrupt visitation arrangements that women have, which can obviously be very distressing and be a source of grief and trauma as well. We are seeing issues for women who have insecure immigration status, perhaps don't have recourse to public funds, so don't have access to social security and housing support. I think there's been a degree of uncertainty about whether clients who do have uncertain immigration status can access the emergency accommodation that's available during COVID-19. We are seeing in London a high proportion of those accessing the hotels are clients who have no recourse to public funds, but that will vary across different areas, and there are definitely concerns about move-on options, long-term housing options for that group. And certainly there's great pressures on mental health during this period. A higher proportion of our female clients face challenges with their mental health, about 8 in 10 in usual times in our accommodation services, and certainly the stress and anxiety of lockdown and the pandemic is going to have a big impact. Also, we're seeing concerned about seeing the impact of loneliness on people About a third of our female clients in usual times struggle with loneliness and isolation, and I'm sure this period will only increase that challenge. So I'm going to hand over to Louisa now to talk a little bit more about domestic abuse and COVID-19 and some of the work we've been doing to develop guidance.
Great, thanks for that, Kat. My name's Louisa, and I'm the Housing First and Homelessness Coordinator at Standing Together Against Domestic Violence. So Standing Together are a London-based organisation. We don't do frontline support with people, but we do work on improving the partnership response to domestic abuse across a really wide range of agencies, housing, health, the courts, and so on. So my work focuses on homelessness and looking at really increasing capacity around domestic abuse and other forms of violence against women and girls, other gendered violence in homelessness settings. So just to go into a little bit more detail on domestic abuse and COVID-19. Obviously, we know that homeless women experience a really wide range of gendered violence, not just domestic abuse. But with this guidance, we really tried to kind of focus in on that. And I think some of the questions and the way things are phrased could be used to talk about other forms of gendered violence as well. So in terms of domestic abuse, Kat kind of covered it briefly there, but we've definitely seen a rise in domestic abuse cases during the pandemic. So our Women's Aid Federation of England, which is our kind of national membership body for women's domestic abuse organisations, experienced a 41% increase in users visiting its live chat sites in the first 3 weeks of lockdown. So women's sector is, definitely adapting, and online services and like chat rooms and things like that, and remote telephone support. Another organisation reported a 700% increase in calls to its national domestic abuse helpline in a single day, and are seeing much more complex cases of domestic abuse than they normally would. So we know that women and girls are at much greater risk at the moment by isolating perpetrators and limiting their ability. COVID is limiting their ability to safely access support. So in terms of, so we know that risk is increasing in the general population, but I think for those who are most marginalised, it is increasing even more so. So for homeless women with multiple disadvantage, this crisis is definitely affecting them disproportionately. And we know that they are at much greater risk of exploitation during the pandemic, as well as being at risk from COVID-19 itself. I think Kat's point about needing to remember that COVID-19 is not the only risk, that this group of women are at risk from a wide range of different things, and that COVID-19 and the pandemic really increases their risk of exploitation and abuse. Support available from specialist agencies. I think at the moment, as I said, Women's Specialist Services, there's been a really creative response, moving online, offering support over the phone as much as possible, and trying to still do some face-to-face stuff, but as safely as possible. And we're seeing some really fantastic and creative responses to that, which is really great. I think we're also at Standing Together, moving something that we call, I can send on the links for this, but the multi-agency risk assessment conferences, which are local multi-agency meetings that we hold for high-risk survivors of domestic abuse. We usually hold those in person with all the agencies once a month, and those have been moved online now, and we've got a plan for doing those virtually, which I can send a link to, which is fantastic. So it really is about being creative around that. Okay, so on to the next slide. I'll just talk about the guidance a little bit more. So social distancing versus support. So Kat's already filled you in a little bit on the situation that we have with emergency accommodation for COVID and these large hotels that we have across London now. I think there are at least 10, and indeed in other areas of the country too. I think things have happened really quickly, and the push was really to get people indoors. And I think obviously there's a lot of women in these large mixed sex environments, which can be, you know, quite scary for them and increase their risk. And I think as this crisis goes on, it's likely that more issues will start to emerge as well. I think, you know, the workers in the hotels are doing an absolutely fantastic job. I think the staff in the homelessness sector are just really surpassing expectation and working under some really difficult conditions at the moment. And I think as time goes on, support needs are only going to be kind of coming to light and increasing. So I think there's a real need, as well as obviously this emergency housing response, to make sure that women are getting the support that they need to. So we created this guidance to try and support staff, very busy staff, to provide them with a quick, handy kind of script, I suppose, to ask about domestic abuse, both over the phone and through face-to-face welfare checks. And Kat mentioned earlier on that for a lot of staff in these hotel environments, they don't have, a lot of the time, they don't have much information about these clients, these women. So this was designed to be used for if the staff member knows the person, or if they don't, to kind of go both ways. So I think, I suppose what's key, I won't go into this too much, but what's really key is that the section on here, which is about asking, validating, supporting and referring. So asking is obviously really, really important. I think there can be staff have definitely reported that they don't feel that confident to do that. And we have had some really good kind of anecdotal feedback about this guidance, that it has enabled staff to feel a little bit more confident with the scripts that it contains, to ask about domestic abuse in the right way as well. So avoiding using professional language that people won't understand, and asking about relationships and really trying to work out, you know, if that person's feeling frightened, afraid, anxious, if their partner's causing them to feel like that, or do anything that makes them feel like that. So really asking in the right way, and also just being really aware of safety considerations, because we know that doing phone welfare checks, that the survivor may well be self-isolating with the perpetrator, so that's got to be done as safely as possible, and the same with the face-to-face welfare checks as well. So obviously, after asking, really important to validate and really reinforce, thank the survivor for sharing and reinforce it's not their fault. Point them to ask them what they want to happen next. It seems like a fairly simple and a bit of a no-brainer, but it doesn't always happen. And how you can kind of safely keep in contact with them. I know here in London, it is really about, you know, if people don't have phones, trying to get them phones and really keep that contact going. And then obviously making sure you refer and report. So refer into specialist women's services if that's what the person wants. Contact those services for advice and support around managing that case. and make your referrals to your statutory safeguarding or multi-agency risk assessment conference for high-risk survivors of domestic abuse as appropriate. So that is a little bit on the guidance. Okay, if you want to move on to the next slide, Kat, that would be great. And just very briefly as well, we know that a lot of survivors are in couples, and that in these hotels and emergency accommodations, couples are being housed together. So St Mungo's has done some fantastic work on this, and I'll just point you to the bottom point there. The St Mungo's Couples and Relationships Toolkit was released during the lockdown, and never has it been. It's a very good time for that, I think, because we're seeing obviously lots of issues around housing couples together. Also, there's the risk there if couples are separated. There's a high risk of abandonment and eviction. Anecdotes, so an example that I can think of is that outreach teams at the moment are reporting that maybe women are wanting to go into the emergency accommodation, but their male partners, perpetrators, aren't allowing that to happen, and meaning that they both sleep out and both obviously remain, you know, at real risk. So there's some real really helpful points in that toolkit as well. And obviously placing couples together in one room, there's a really high risk of domestic abuse if that's an issue for that couple, and thinking about having separate rooms within the same accommodation is really important too. Okay, I think that is it. So we've got time for some questions, if that's okay, Robbie. Just a little bit of time.
Yeah, perfect. That's no problem. So if anybody has questions, they can feel free to throw them into the, just one moment, take the screen back so we can all see each other again. So if anybody has questions, please feel free to throw them into the questions box. I'd just like to kick things off really quick by asking about, I thought it was really telling that you mentioned that even before COVID-19, a third of the women that you worked with at St Mungo's reported isolation and loneliness. And so how do you combat that in COVID-19, where a lot of day services are closing, some people might not have access to a telephone. Do you have any suggestions for how services can respond to that?
Yeah, sure. So obviously in usual times, we'd be looking to, you know, increase people's healthy social contacts, organise group activities, and really kind of build up trusting relationships between clients and staff. And that is all more difficult during this period. I know St Mungo's runs recovery colleges. So those are, that's a set of services where volunteers and staff and clients themselves also run courses to extend their learning. Those could be basic things like literacy, computer skills, but also, you know, interests and things that people may have passions for. And they have taken that provision online, and they're thinking about setting up, I think they're in the process of setting up, posting out kind of packages of materials, activities that people can do during isolation, looking at doing video, Zoom activities where that's possible and where people have the technology, but also offering the opportunity for people to just phone in as well if they've not got a smartphone or a tablet. So I think that's one thing people are trying. And again, as Louise said, being really creative and trying to figure out how to connect people during this period. But it's certainly something we're going to have to think about more in our project, as we were really hoping to speak to clients about their own experiences of safety.
Mm-hmm.
And that's something we'll have to learn and adapt as we go through this period.
Great, thanks, Kat. Louisa, I don't know, do you have any comments on the element of isolation? Do you have anything to add? Or?
Yeah, I think it's a really good point, actually, because a lot of women are going to have really considerable experiences of trauma and being on their own, self-isolating, whether that's in emergency accommodation or their existing accommodation, is going to be incredibly difficult for them. And I think it's really important that the support, the right levels of support are still in place, so that nobody is kind of left on their own with that. So I think anything that people can do to really maintain that connection, in terms of, you know, buying cheap mobile phones and with daily welfare checks, and as Kat said, that wonderful extra stuff around, you know, posting art materials or something in the post, colouring books, that kind of thing.
We have another question. I know it was kind of an add-on towards the end, but could you say a few words about the toolkit for couples that you mentioned? I think it was there in the last slide.
Yeah, of course, I can say a bit about that. So that's been put together by a colleague at St Mungo's, Dylan, who's been working really hard for about a year to put together this toolkit, which has really been around talking to teams in London about the challenges they're facing, accommodating and working with couples who've been sleeping rough for a long time, who perhaps have not been able to access accommodation separately, would prefer to stay together, and may end up sleeping rough for much longer because they're in a relationship. And the toolkit gives advice on all sorts of areas. So it's got great advice on everything from kind of substance use, mental health, accommodation, working with LGBT couples, working with Roma couples. There's all sorts of interesting information in there that I'd really recommend people look at. It's available on St Mungo's website if you wanted to look at that piece of work. And though it's not COVID specific, I think it's really timely because we are seeing people who've perhaps been sleeping rough for a long time, and that does include couples quite often, coming into accommodation perhaps for the first time in a long time. And staff will have challenges working with that, especially if there are concerns around domestic abuse. And this toolkit, I think, gives some really great advice on how to respectfully speak to people about their relationships and honour the fact that people will have personal and intimate relationships while they're homeless, while also having a realistic assessment of the risks involved in that. So yeah, I'd absolutely recommend people take a look at that, and do get in touch if you have any questions. I'm sure Dylan will be happy to answer those, and I can pass them on.
Great, and just to add that we tomorrow we'll be sending out a follow-up email with the recording of this webinar, the presentation, and we'll include those resources. So both the guidance from both of your organisations, and we can also put in a link to the toolkit as well. For specialised services such as yourselves, are there any extra funding or money from government to support your increased action at the moment? That comes from Lara in France.
Yeah, there has been investment. So on the homelessness side, there has been investment from government, I think, and it was fairly rapid. I think it was, you know, I think the visibility of rough sleeping has been so great in the past year or so across England, not just in London, that I think there was a lot of pressure from the public and obviously from homelessness charities to act very, very quickly when the lockdown was enacted. So there is funding. There's funding for local authorities to help them support people at this point. I think the question now is how long that funding will last for and whether it is sufficient. The measures that have been put in place are very much an emergency response, and I think now the crucial thing is what will the next step look like for people when they do move out of these very temporary accommodation arrangements. It will be such a missed opportunity if we'd effectively, 90% ended rough sleeping at a stroke in this country, and then there wasn't the funding in place to maintain that. But I know the women's sector's in a bit of a different position, so perhaps Lucy, you want to talk about that?
Yeah, I think so. The government has announced an additional 2 million for domestic abuse services, but I think definitely further funding is needed for community and accommodation-based services to give women and children experiencing domestic abuse safe means to escape. It's been estimated that at least 48.2 million is needed to meet the increase in demand for VOG and domestic abuse.
So 2 million is really just a drop in the ocean.
It's a little bit of a drop in the ocean. I mean, the government is recently, the Home Office have launched a campaign called You Are Not Alone, which really tries to get across to people that isolation rules do not apply to you if you're experiencing domestic abuse. But I think definitely, and the 2 million is of course welcome, but there's definitely more funding needed there.
Yeah, and I think a lot of countries have that same concern that you shared, Kat, that as we start to talk about what comes next in, ending lockdowns and lifting different measures, if you start to reboot the tourist industry and you have people coming in, all those hotel rooms that are now being given to homeless services, they'll be taken back, and where do all those people go? It's a huge issue of
Absolutely.
concern, I think.
Yeah.
And it's not just
I know.
the accommodation, it's the support, the right level of support to go with it. Really important.
Of course. I know the guidance is quite new, but we had a question to ask. Have you had any feedback yet on the guidance, either from other services or from workers?
Yeah, we've had a little bit. As I said, I think workers in homelessness staff kind of generally report that they often have all of the skills to be able to respond to domestic abuse appropriately, but lack the confidence. And I think that we've had some anecdotal feedback that the scripts are really useful. I think obviously it's difficult at the moment. I think it's going to become more useful over time. The initial response has been very focused on basic needs. So getting people inside, making sure people have food, staff need access to personal protective equipment, that's very important. So I think the initial response has been very focused on basic needs, but also I think this guidance is important because it's really reminding staff that all of these other risks hasn't gone away, and in fact they will increase, and they will be seeing increased domestic abuse in their services during this time.
Yeah, I think that's right. And just to add, I think the other feedback that we're starting to hear is that the guidance is helping staff, I guess, have permission to do a little bit more. I think in a time when there's limited funding, there's a lot of pressure, people are being asked to focus on coronavirus. I think having guidance that says you can do these other things, for example, making sure couples have 2 phones instead of 1 phone, just simple things like that, where you think actually staff might not feel like they can justify that during this period if we're really short of supplies and money. But when you spell out, no, this is why it's a great idea to be able to maintain contact with 2 people individually rather than just as a couple. I think it gives staff a bit of sort of backup when they have a hunch that something's not quite right and they want to be able to provide something more for their clients. Hopefully, what we're hoping is this guidance will sort of help staff, make the case, I guess, to their organisations that they can do a little bit more for individuals and not just for couples together.
And at the moment, are there any plans for those who are staying in hotels once those spaces are no longer available to them, or is that too early to start discussing?
I think
no, we're starting to work on it. Yeah. Go ahead.
We're starting to think about it. I think local areas across London are starting to consider what that might look like. But I think it's very much something that we need to start focusing on as soon as possible, really. Kat, what do you think?
Yeah, I think it varies a lot depending on the situation of the individual. So for some people, they will have move on options available to them. They may, have access to housing benefit and perhaps have a decent option in social housing or the private rented sector, so they can move on sooner before the pandemic period's over. But for those clients who perhaps their immigration status means they don't have access to benefits or housing support, it's much more difficult to know what the next step is for them. So they will be, I guess, in this emergency accommodation for as long as possible, but then the next step's less clear.
We have one last more practical question from Anya in Spain, who's wondering, is it possible to translate the guidance into Spanish?
Ooh, we'd love to.
Really wonderful resource, and is quite happy, I think, to take that on. I can connect to you afterwards, but I assume that's something that you're open to. And if there's other participants from other parts of Europe who are quite interested to use this as a document that they translate to use in their own services, because it is a really wonderful resource. And I think things are moving so quickly now that often there's no point reinventing the wheel if it's a really good resource in one country to try and mobilize it.
Yeah, we're more than happy to share, and we want the guidance to be used as widely as possible. And if we can work with with fiança or with organisations on that, yeah, I'm more than happy to talk about that, definitely.
Perfect. So if anyone who's participating is interested in the guidance and they want to be able to use it or translate it into their own country's language, please send me an email after the webinar and I can connect you in with Kath and Louise and we can figure out a way to do those translations. That's it for the questions. I just want to thank you both again for joining us this morning. It's really wonderful resource and something that you really put together super quick, and I think people really appreciate that as well. So thank you so much for putting together the guidance in the first place, and secondly for coming on and sharing with us. And we'll be sending out a follow-up email with all the information and resources tomorrow.
Lovely.
Thank you.
Okay, right.
Thank you very much.
Thanks everyone, and have a lovely day.
Bye everyone.
Bye.